Washington's mask mandate is lifting in 4 weeks, and hospitals are slowly emerging and overcoming the Omicron wave they've faced for the past few months. Cases are going down, and elective surgeries are picking up at Sacred Heart, but staffing shortages continue to be an ongoing struggle for management and the healthcare providers who are overworked. In our coronavirus coverage, Emily Bloom explains how there could be relief on the horizon.
The mask mandate is lifting in most areas next month, but for healthcare workers, those masks aren't going anywhere. Providence Sacred Heart is starting to increase non-emergency surgeries, and while this is a step in the right direction, they're still facing major staffing shortages as they move forward.
Since the start of this last wave, we're over 600 cases that we had to delay. And if you went back to when we had our first big wave, really big wave in September, it's in the thousands.
COVID cases are down, but healthcare workers can't sigh relief just yet. They're now looking at this backlog of cases.
It's going to take us a lot of time to catch up. And then, unfortunately, I'm sure we'll see cases that present that had we had a chance to deliver care earlier, outcomes may have been different.
Staffing shortages are not a new problem.
And the pandemic really just exacerbated that.
There's a bill going through the Senate right now that's creating optimism and concern across the healthcare world.
We have some very legitimate concerns about what this would do to hospital capacity across the state.
House Bill 1868 is for improving worker safety and patient care in healthcare facilities by addressing staff needs, overtime, meal and rest breaks, and enforcement. But not everyone feels this is the solution they're in desperate need of right now.
We've asked healthcare workers to move mountains, and they're burning out at record numbers.
This Sacred Heart nurse feels that pressure.
When my shift ends, I'm devastated because I know I was unable to provide the quality of care that they deserve because of short staffing, and that knowledge is demoralizing and crushing.
We'll know in the next few days if it gets a vote from the Senate Labor, Commerce, and Tribal Affairs Committee to move forward. Even if it does get that far, there will be a few more steps ahead. Reporting in studio, Emily Bloom, 4 News Now.
And here's what people are clicking